SAGES Stories.
Welcome to today's episode of SAGES Stories, the official podcast of SAGES, the Society of American Gastrointestinal and Endoscopic Surgeons. Please make sure to hit the like button and subscribe so you can stay up to date with our most recent episode, and enjoy the show. We are back yet again, this time for episode 17 of SAGES Stories, where we shine the light on some of SAGES' most impactful leaders. I am Dr. Shirin Tofai from Los Angeles, California.
And I'm Dr. Kevin L. Hayek from Cleveland, Ohio, sporting my new favorite shirt. You see this?
I see that, Kevin.
Yeah.
Our listeners can't see, but he's got this beautiful shirt that says "Got Hernia" on it.
Yeah, absolutely. I was happy to support my fellow hernia surgeons, especially those on the West Coast. So thanks for this lovely addition to my wardrobe.
Oh, I love that you're representing. Thank you so much.
Anytime.
You know I love my hernias.
I know. We can't get through any podcast without hearing about hernias. So.
Or Cleveland. Actually,
That's
maybe
true.
Not this time. We'll see.
Not this time, yeah.
Okay. Well, let me introduce our guest for today. Many of you already know him very well, Dr. Nat Soper. Dr. Soper received his medical degree from the University of Iowa and went on to do general surgery residency at the University of Utah in Salt Lake City. He then completed a National Institutes of Health, or NIH, postdoctoral research fellowship in the Digestive Diseases Center at Mayo Clinic. After that, he spent several years on the faculty of Washington University School of Medicine in St. Louis before moving to Northwestern University in Chicago in 2003. He was chairman of the Department of Surgery at Northwestern from 2007 to 2019, before migrating westward in 2020, where he has been serving as chair of the Department of Surgery for the University of Arizona. We have a lot of good friends at all of these institutions. There's obviously a lot more to his story than that, but that's why we're here. We can't wait to dive into your story, Nat, and thank you for coming.
Well, thanks for having me.
Yeah, and I don't know if you've gotten a chance in your, probably not given your busy schedule, but if you've listened to any of our previous episodes, you'll know that the main purpose is to really get to know some of our SAGES past, present, and future leaders. Certainly, you've been on our list for a while, and we are excited to have you. So to start, why don't you tell us a little bit about your early years? Where did you grow up? And what were some memorable events along your journey to becoming a surgeon?
Well, first of all, I have to say I'm kind of bummed for being number 17, for goodness sake. But
Oh my God.
Oh, we shouldn't have said that. Yeah.
I'll take what I can get. No,
Will it help if you know that the others were a little bit older than you?
Oh, yeah, exactly.
Okay.
If you hit 100 years old, you
Yeah.
can't be down to number 17. You have
Got
to
it.
be
No, I understand that very well. No, yeah, I grew up in Iowa City, Iowa. My dad was a pediatric surgeon, actually one of the first fellowship-trained pediatric surgeons in the United States. In fact, we went to Liverpool to train in 1960, and I never saw the Beatles, but I liked them later in life. So in Iowa City, initially, we actually lived out in the country. We owned a horse. Yeah, we did all kinds of stuff outside. I was really angry at my dad for not letting me get a .22 rifle until I was 8 years old.
Oh my God.
Because my two older brothers already had them.
Wow.
And then we moved into town later on, and we lived within a few blocks of the University of Iowa football stadium and the hospital and things. And that's where I went through high school. I had a little bit of a travel lust. I was an exchange student in Australia. And one day my dad said, well, where do you think you want to go to school? And I said, I want to go to Stanford University. And he said, well, we can't afford that. So you better set your sights down a little bit and maybe go to some state school. And at that point, I had no idea what I was going to do. This is in the early 70s, so you didn't want to follow in the footsteps of folks. And I caught wind from a friend of my dad's that there was a place called the University of Victoria on Vancouver Island in British Columbia.
Yeah.
It happened to be during the Vietnam draft, and it's in
Mm.
Canada and on an island near the mountains. And I'm coming from Iowa, and I thought, wow, that sounded really cool. And it sounded even cooler when they wrote me back, accepted me, and said that the tuition was $424 a year.
Wow.
After the first year, I did well enough. I got a quote full ride scholarship,
Of course you
and my
did.
parents spent $424 on my undergraduate tuition.
Wow.
I think they
And
spent
I
that
thought I
on
was gonna be
my on my lunch in
That's
undergrad.
right.
One of my
I-
lunches cost that.
And
So
I went there thinking I wanted to be an oceanographer like Jacques Cousteau,
That's
but
cool.
after a couple of semesters of algae and plankton and really loving biology, I realized, oh my goodness, either I'm going to be a high school biology teacher or I've got to think of plan B. So I took the MCATs, did well, and was accepted to the University of Iowa Medical School, where I swear I would never be a surgeon.
Oh yeah.
And but it was one of those typical stories where I kind of liked everything, but surgery chose me. On my first day of clerkship, it became apparent that that fit my personality and things, and so I decided to become a surgeon after all.
So you did surgery first?
No, this was halfway through the third year.
mm,
Oh,
When,
right.
you know, I'd been on medicine.
Wow.
I kind of liked
Yeah.
that. I've been on psychiatry. I hated that. You know, there were a bunch of things that were okay, but surgery reached out and grabbed me. And as it turns out, on that first day, I was assigned to a Whipple operation that took 12 hours. So if I could get caught by surgery with that experience, then just shows how sick I am.
no, that's my favorite operation. So I have to say that you know,
Not the 12-hour ones, though.
well, no, the 12, yeah, no, you're right. Yeah, the 12-hour one's definitely not my favorite one.
Yeah, we also had this Whipple discussion last week with Kevin, which was, yeah, the Whipple, I think it's just such a special operation. Even for a hernia surgeon. If I had to choose one operation, which is like the coolest of all, I think it's the Whipple.
Well, it certainly is one of the most complex.
Yeah.
And, you know, it's too bad you don't cure many people by doing that, but
Yeah.
that would beat
Yeah.
the alternative, I guess. Yeah, so I went to the University of Utah. I mean, as it turns out, John Hunter was a year behind me, and so we
Wow.
were good buds during that period of time. And remember, this is pre-video laparoscopy,
Right.
and so and there was one crazy private practice surgeon who did diagnostic laparoscopy, and we all thought he was nuts. You know, he'd make a little incision on the belly and then, you know, put his eye to the eyepiece of the laparoscope, dragging his face across the patient's belly.
Right.
And every
Mm.
once in a while, he'd let us put an eye to the eyepiece to show us what he was seeing. And again, we thought he was nuts, and that there wasn't much to that technology at that point in time. A new operation had just been described, and that was the ileal pouch anal pull-through procedure. And one of the young faculty at in Salt Lake had just come back from doing a fellowship at the Mayo Clinic to learn how to do that. And I thought it was really cool. And he said, well, look, when you graduate, do that same fellowship and I'll recruit you back to Utah. And I thought, okay, that sounds good. Go. And it was a research fellowship, operated on nothing but dogs and pigs for a couple of years. And midway through my time there, doing basic science research on intestinal motility and the ileal brake and gastric pacing and stuff like that. The guy who was going to recruit me back went to WashU. And so I got recruited to WashU to do maximally invasive surgery and basic science research. That's what I thought I was going to be doing. Now, as it so happens, this same guy, Dr. Jim Becker, had a side project that was being funded by a chemical company. This was right when biliary lithotripsy was thought to be the next coming.
Yeah.
You know, kidney lithotripsy had been shown to work, and so people thought, why not bust up the gallstones and not take out the gallbladder? And so we were trying in dogs ways of putting percutaneously clipping the cystic duct, then putting some chemical in the gallbladder that would ablate the mucosa so the gallstones wouldn't come back. That's what we were working on. And Barnes Hospital purchased 2 lithotrippers, one controlled by GI medicine and GI surgery, and the other by radiology. And when it failed, as it inevitably did, then we would try to do these mini cholecystectomies with tiny incisions, and they were horrible. And you couldn't teach because only one person could see at a time.
I always
But-
wonder about that.
Yeah,
You can only fit one hand in
No
there.
one ever
probably.
said how horrible it was. They always talk about it, and they never ever said it was actually not good.
oh, it was not good at all. Thankfully, we didn't hurt anybody. But and I was actually giving a lecture in Jefferson City, Missouri, in December of 1988. I had been on faculty for exactly 5.5 months. And a nurse came up to me after my lecture on lithotripsy and said, "Have you seen this publication?" And it was Laser Monthly News. Now, I didn't get it then. I still don't get that journal. But it was actually, I think, the first publication, Eddie Joe Reddick, 2
Yeah.
patients treated by the laparoscopic laser cholecystectomy with, out of the hospital the next day, almost no pain. And I thought, oh my goodness, this makes sense. None of this lithotripsy and mini cholecystectomy stuff. So I went back to St. Louis. I talked to some folks. There was actually a crazy urologist there who had an in with Carl Stort's company, and he had been trying to get general surgeons to think about doing laparoscopy for about a year. So I talked to him, and he was able to get some old beaten up OBGYN equipment from Carl Stort's. I went to my chair and said, "Can we divert money from this one research project on the dogs and ablating the mucosa?" And he said, "No." But we went ahead and did it anyway. And I went back to the chair with 5 little piggy gallbladders in formalin. And I said, and this guy was Sam Wells, who was kind of bigger than life. Didn't call him by his first name till I was a full professor, and said, "Dr. Wells, this really is the thing. We got to do this." And so he gave his blessing. We did a number more pigs. I then worked with a gynecologist to learn how to actually put ports in a human, all metal ports, of course. And then called down to Eddie Joe Reddick's place in the West Side Hospital in Nashville, Tennessee. And my secretary talked to his and said, "Could I come down and watch?" He said, "Sure, come on down." So I went there in early August of 1989. There were about 8 surgeons watching him and Doug Olson. They did 3 laparoscopic laser cholecystectomies that day. One of the other.
Why did they call it laser cholecystectomy? What was the impetus for that?
They did it with laser beams.
So they thought that it was unsafe to use electrocautery in a closed abdomen because something might explode.
Okay.
So to use the laser to
do cautery,
catch the gallbladder from the liver bed.
So they were wearing like laser protection glasses and everything?
No, they weren't, because it was all inside.
Inside, okay.
Right, and it was on a video screen. I mean, it was very well done.
Laser was a thing back then, Kevin. You weren't born yet, but laser was a thing.
Okay, so
I even had a laser certificate. That's how far back.
Okay, so it's laser cold. So they were worried about cautery then,
they were worried about cautery, yeah.
Okay.
And one of the other participants that day was Joe Peatland. Now that may be a name.
Yeah, definitely.
And
all names have
he and
come
I
up.
both
This is
looked at
great.
one another and said, "Oh my goodness, we got to do this." But then he told me that we were being charged $1,500 to watch him that day, and nobody had told me that, and I had no money, so I kind of skulked around and hoped nobody would see me the rest of the day. But sure enough, I got an invoice the next week from Eddie Joe for $1,500 for my fellowship in laparoscopic laser cholecystectomy.
Right.
Wow.
I went to my chair and said, "What do we do with this?" And he said, "Well, we never charge people to come watch us. Why don't you write him a letter and see what he says?" And I did. And I got a nice letter back that I have on a slide somewhere from Eddie Joe saying, "I'd rather have your goodwill than your money. So you can make it up to me, buy me lunch in St. Louis."
Okay.
Well, that's nice because we've heard this multiple different surgeons kind of share this story about these $1,500 courses and being able to watch them.
Well, this wasn't even a course; it was just watching.
Yeah, it was observing.
Just watching.
You were observing for.
And right, so so then, you know, in my mind, Katie barred the door, and we actually got the chair's support to go to the OR technology company, and they agreed to buy a tower and the rudimentary laparoscopic equipment that was available then. And it was through Carl Storz, and they said, well, yeah, you can have one, but there are none they come off the production line about once every week. And your set is going to be shown at the ACS meeting in Atlanta in October, and you can have it after that meeting.
Okay.
So that meeting in 1989 was where there were two booths that had videos of Eddie Joe Reddick doing a laparoscopic laser cholecystectomy at the laser booth and at the Carl Storz booth. And there were surgeons lined up 100 deep watching those, and 3/4 of them shook their heads as they walked away and said, this is nuts. And about 1/4 were ordering the equipment as fast as they could.
So cool.
That's kind of how we got started. Oh, and in terms of the laser, we didn't have a laser when we were doing these operations in pigs. And so we just shrink wrapped a long cautery thing up to 5 millimeters and used it, and nothing blew up. And we actually reported that a couple of years later that it was safe. But
so you went straight to cautery.
We went straight to cautery.
Wow.
And to give you an idea of how fast things were moving, that same urologist and I 6 months later did the first laparoscopic nephrectomy in the world.
Oh, wow.
I think I saw that in your CV. Yeah. Do you publish that, correct? Didn't you?
Yeah.
Yeah, that's right.
But
I was
when
like,
you think of it,
that was like
6 months later,
that was like 1991 or
it was
something.
1990.
In 1990,
So
yeah.
early, wow.
I mean, I saw it, I was like, what? That is insane.
Yeah, no, it was crazy times.
And your time during at WashU, were you the main person moving laparoscopy in that hospital, or did you have
I was
colleagues?
the only one for
Yeah.
a number of months. And it was so obvious to me that this is the way that gallbladder should be taken out, that I had to teach the other faculty members first, then the chief residents, then the fourth years, then the third years, and so on and so forth. And so it took a number of months, but one of those people I taught was Mike Brunt, because he was on faculty with me. And that's what really got him interested in laparoscopy.
Well, I don't know if I've shared you my story about how I got involved and interested in laparoscopy, but you're a very strong part of it. I don't know if you remember or know. So
what did I do this time?
Again, Kevin, you probably were not born, but in the late 1990s, when I started residency at UCLA, I think around, I'm going to say maybe 1998, around then, or 99, you were invited to UCLA as a grand round speaker. And tradition was that the grand round speaker would then spend like a lunchtime or like an after grand rounds time with the lab residents, mostly for mentorship and guidance. And it was really cool to be able to have like a one-on-one, like a very close, intimate setting. There's only like maybe 10 of us, 6, 7, or 8 of us with someone like you. So at that time I was in the lab and you were the invited speaker. And I loved, my whole thing was about surgical education. And I think your talk had something to do with teaching residents how to do laparoscopic surgery and skills labs and laparoscopic cholecystectomy. And you had like videos you would show them. You had like this whole protocol, which at the time we didn't have such a kind of regimented way to do it. And so I met you there. I met you for lunch, and you were, I think, I remember very specifically the room we were in, where you were sitting, where I was sitting, where all the other my colleagues were sitting. And I was just blown away. I'm like, who is this person and how can I be just like him? You were the reason, no joke, you were the reason I chose to go into minimally invasive surgery.
Wow, that's cool.
Mostly because you were not only really like passionate about it, but the whole surgical education part of it was so critical, as opposed to other surgeons that did laparoscopic surgery, but the education piece was not their passion. And
That's an amazing story.
Every time I
That,
see you, I remember
wow.
1998 or 99, whatever that was.
Well, that makes me feel really good, because I am passionate about what I've done and what I continue to do. And in my mind, that's the antidote to burnout. If you find what you're
Mhm.
passionate about and can actually do it on a daily basis, then you win.
Yeah.
And I've
Try and
been
beat that
passionate
story,
about
Kevin.
education as
Yeah,
well.
I'm just floored by it. It's
Yeah.
and actually that's been one of the really cool things about bringing on some of Sage's leaders and getting the chance to dig deep is kind of understand, what makes them tick and how they got to where they were, because obviously as we meet them and we meet people like yourself, it's, we see the kind of the polished end product, but we know there's a lot of grit that went into it. And flying to Nashville and getting an invoice for $1,500, I mean, that's just, it's not something we didn't read that on your CV. So you got to dig a little bit deeper. And
Yeah.
Well, and speaking of Eddie Joe, so he then started up a training center for laparoscopic cholecystectomy down in Nashville. And he would rent pigs from a nearby pig farm. And he got me to come down. I helped him teach a couple of courses. And that's about when SAGES courses just started taking off. So I was really involved in those primarily. But and then Eddie Joe learned that if you take out the gallbladder of a piglet, they grow to market weight faster. So he bought the farm next door and would lease the pigs across and then get them back and sell them. And there were two occasions when I was teaching courses and they took the wrong pig to the lab, and we'd get in there a couple of clips in the right upper quadrant. And the surgeons were wondering, where's the gallbladder?
Wow. Yeah. So, I mean, it's pretty clear, and your passion kind of comes through, that your passion for MIS led to significant involvement in not only SAGES, but many other surgical societies. Of course, SAGES Story is the official podcast of SAGES. So we love kind of hearing about our guests' introduction to SAGES, and maybe some talk about how you were propelled into many leadership roles, of course, culminating with your presidency about 20 years ago, a little over 20 years ago, from 2000 to 2001. So I'd love to hear about that story.
Well, back in 1989, actually, one of the faculty members at WashU was a member of SAGES because he liked to do colonoscopy. And I was doing some flexible endoscopy as well. He suggested I join the organization and then started doing laparoscopy. And it became apparent that SAGES was really the only association that actually not only didn't poo-poo laparoscopy, but actually was embracing of it, because I would put an abstract into the American College of Surgeons or to SSAT and they wouldn't even look at it, this laparoscopy crap. And so I actually went to my first meeting, I think in 1990, and they got me involved immediately in teaching SAGES courses. And I remember teaching in the Learning Center at SAGES out in California somewhere. I can't remember exactly where it was. And having me teach laparoscopic suturing, and I couldn't suture worth a damn, but I was teaching at the Learning Center. But they got me involved, and there were so many opportunities as this blew up in our faces. I mean, laparoscopy just exploded. And the interest level among surgeons was so high, and SAGES was by far the organization that was really carrying the torch, but also trying to make things safer with its Train the Trainers initiative. And so I got very involved in those things. And, over time, I was given more responsibility. I was the meeting chair. I don't remember what year, probably 1997 or 8, something like that. And there was just me, and doing the whole meeting. And that was quite.
Oh, wow.
I also remember Lee Swanstrom and I sitting down with Sally Matthews in the late 90s at WashU, to put together the basics of the FLS course and throwing it around. How could we do this? We thought there were a lot of trainees who knew nothing about a CO2 pneumoperitoneum or the potential dangers of laparoscopic surgery or, any of that. And so we thought that was an important thing. And then we heard what Jerry Freed was doing and grabbed him for the technical side of things. But it was in those days you could, as long as it seemed to be reasonable and pushing the field forward, there were very few barriers. And the SAGES group just wanted us to be involved and kept pushing us. It was great.
That's really cool. And you're still very active at chairing committees and doing other projects. What should we know about your current activities at SAGES?
I'm not doing as much at SAGES anymore, and it's time to pass it off to other folks. What I love about SAGES, I am a member of a bunch. There's no other society in the world, I'm sure, that does as much to give back to the membership as SAGES does, and to people and to surgeons who are not members. I mean, the SAGES University stuff is just incredible. And now all the video-based analysis and, going right one thing after another, there's no stopping. And, when I joined, I think there were 3 administrators, Barbara Bursey, Sally, and I think one other at the time, trying to do all this stuff. So you can imagine now with the Army they have, it's incredible that they keep investing so much in education. And I think it's just wonderful. So certainly SAGES is the organization that I feel closest to.
Same.
Certainly. I think even looking to woven into years of service to SAGES, as well as having a busy clinical practice, you had many invited lectures around the globe. And it's actually funny to see many of the titles of these talks given decades ago and how relevant they are today, like laparoscopic management of gastroesophageal reflux disease and management of gallstone pancreatitis in the laparoscopic era, in the late 90s and early 2000s. These are hot topics even today. And it kind of reminds me of King Solomon's ecclesiastical lament that there's nothing new under the sun. So, I mean, what have you seen? I mean, even your lithotripsy, we're on to lithotripsy now and, sharing it with urology and getting back into bile duct exploration. And, we had George Bursey on. And so, I think it was just seeing that we've, woven throughout. What have you seen change since leading the discourse and the narrative on this, 4 decades ago now?
Well,
it's crazy.
It's getting to be a lot more scientific and not just experiential, which it kind of was. I mean, back then, we could go into the lab and do 10 small bowel resections in pigs laparoscopically and publish it the next month, sort of thing, and so there wasn't as much rigor because everything was so new. We were very fortunate to be able to work with industry and get a lot of money for the lab. I mean, I never made a penny off any of the stuff I helped design, but I mean, we helped make the initial clip applier and some of the initial trocars and staplers and things like that. But they funded my lab to $2.5 million a year. And so we were just in there playing. And I had fellows who would go in and say, hey, let's see if there's any tumor spread in a laparoscopy model. And, it was like, okay, sure, let's do it. It's, again, it was fun, but it was a lot of work, a lot of weekends and nights and, none of this 80-hour work week stuff.
But I feel like that, I don't know, it just, going back to when I first met you and then since then kind of following your career, it seems that education has been kind of the center of everything you've done, whether it's the research and learning or improving laparoscopic surgery, your roles at SAGES. So is that something that was always in you? Because there are a lot of educators, but it's not common that you've kind of find one like yourself that is, it feels like it just exudes out of you. So did you learn that? Was it always a knack for yourself? Were you a tutor when you were in high school?
No,
Um,
none of that. I
yeah.
think it just came from passion. And I'm not really an educator. I'm more of a teacher, I think.
Mhm.
And I love the apprenticeship model in surgery. You know, you're hands-on, you know, I wear a lot of different hats, but if I had to get rid of them all except one, it would be a bouffant cap, sitting in the OR or standing in the OR with a resident, lights down and playing video games with music in the background.
Yeah.
And
Cool.
what could be
Yeah,
better?
that's cool.
But I feel like as a chair, you were the same. You know, there are chairmen that are very disconnected, hierarchical in the way that they rule, and others that are very much down to the level of their people, so to speak. More like a servant leader as opposed to like someone that leads from far away. So do you have any comments about how you even led a department that way?
Yeah. Well, everybody's different, right? And they're all the different styles of leadership and stuff like that. And you have to know a little bit of a number of them, but ultimately it comes back to your native personality, how you interact most of the time. And frankly, I like to get along with people. and and my goal, as I had alluded to earlier, is as a leader, I see it as my job to find out what drives the people who work with or for me, what gives them passion, what they're passionate about, and then get them the resources to be able to do those things. That's what I think a chair's job is, and to
Yeah.
build programs, to recruit the right people in, to build programs that you think are going to push the field forward. And so that's what I try to do.
You know, you did spend a little bit of extra time in various leadership courses. I saw that as well at Harvard, as well as the American College of Surgeons. In those courses, what were some of the tips on leadership within surgery, and how have you been able to really kind of continue to lead and grow as a leader over many years?
You know, I think the important things are to know who your audience is. Number one. Number two, that to recognize, particularly in this day and age, that a chair of a department is a middle manager, as well as a leader. So you need to manage up and manage down, and it's the managing up is where you get the resources to help the management down. And I think you need to be present. You need to set an example. You need to try to be positive, even when there's a COVID epidemic and all the nurses have left, and those sorts of things. And the thing I think is probably the most important for a chair is to develop or have emotional intelligence. So you can kind of regulate what you do, but also you can see what effect you have on other people.
That's great.
And I would say that in addition, you've had so much amazing, besides education and or teaching, you had the big research that you've mentioned with like amazing funding and so on. But, you know, Kevin's our hepatobiliary person on this show, and he always loves to talk about this. But I did notice that you've done a lot of research on management of cirrhosis, minimally invasive management of bile duct stones. What of what you've done has been, you think, the most impactful for our society?
Oh, the things that I've talked about with the medical students and stuff here is, first of all, kind of being one of the first academic surgeons to do laparoscopic surgery. Second, I think, was developing FLS. Third was helping to develop, we developed the common bile duct simulator for laparoscopic common bile duct exploration.
Mm-hmm.
I don't know if there are other things out there, but those are the kind of the things that I think are important in terms of helping to push forward the art and science.
Yeah, piggybacking off that a little bit, you've been at the forefront of multiple innovations in minimally invasive surgery, including minimally invasive surgery itself. Innovation continues to be a huge part of a surgeon's career. what are some absolute keys that surgeons have to keep in mind as they innovate?
Yeah, well, I think there are a number of things. First of all, as they innovate, but also as they choose which innovations to pick up.
Right.
And, I think you have to ask yourself, is it safe? Will it be better than the existing alternatives? Will it be something that can be taught to others? And is it not going to increase the price of things, tenfold? And if all of those things, you can tick off all of those things, then I think it's worth trying to invest some of your time to help push that forward. If any of those is negative, then probably not a great thing. I mean, I still can't believe that we were doing natural orifice surgery, taking out people's gallbladders through their vagina or through their stomach. I mean, we were able to do it and didn't hurt anybody, but that in retrospect wasn't really smart, and it did not fulfill many of those criteria that I
You
just.
never know, may come back. It'll be resurgence of notes.
Well, if they can develop good,
Yeah,
flexible instruments
these
that.
platforms are developing.
I'm sure they are, and it'll probably be
they
done robotically. And I mean, I am a dinosaur now in my own institution because everybody wants to do robotics, and and that they've actually convinced me now that robotic hiatal surgery probably makes sense. I hate
Okay,
to
I'd like
admit
to.
it.
Okay, this is perfect because I don't want to call myself a dinosaur, but it really irks me sometimes when, like today, I did a laparoscopic angle hernia repair TAP, and the resident had never seen a TAP before. Everything is TAP because everything's robotic.
yeah,
Right.
right.
And this was
Even the
totally
gallbladders.
extraperitoneal. Even gallbladders are
Even
done robotic.
gallbladders, yeah.
So when I my first job, my chairman didn't really believe in laparoscopy as its own specialty. He considered that a technology. Your
Right.
specialization should be in an organ system,
Right.
and laparoscopy can't be its own service, for example. So we never had an MIS service, so to speak. And then now with robotics, I feel that the beauty and like, for example, this laparoscopic inguinal hernia, sometimes they do them with pediatric 3mm trocars. I don't need 8mm huge honking trocars for a robot to do an inguinal hernia.
Right.
But I feel like we lose a little bit of the finesse of surgery, understanding that there's definitely a lot of positives with robotic surgery for other techniques. So
things.
what is your take on it? Because I'm not anti-robot, but I'm not
Right.
everything must be done robot either.
Right. Well, frankly, at my stage of my career, I've decided not to take up robotics. So now I'm the guy that even the chief residents want to operate, do straight stick laparoscopy and open inguinal hernia repairs. I mean, and laparoscopic, but some are open, do a big scrotal hernia in an hour and a half, whereas the roboticist took 6 hours to do that, that sort of thing. So in my mind, robotics, I think it's a useful technology. I think it's really amazing what can be done. And I think it's valuable for certain areas. But it also adds like $1,500 to the cost of anything that's done. And as hospital systems are looking more and more closely at contribution margins, it's going to be hard to sell that for gallbladders and routine hernias. I think the abdominal wall stuff makes sense. I think the difficult hiatal surgery makes sense.
Yeah.
I think the stuff deep in the pelvis makes sense. I think probably pancreatectomies and Whipples and things make sense because of the ease of suturing. So I think we're going to see it increasingly, but now our acute care surgeons are learning how to do it. And, I mean, it's almost overwhelming. And so, we'll see what happens next. And Intuitive has done a great job in terms of making all the residents want to do robotics and teach them how to do it, and then they demand it.
Yeah, for sure. The marketing has been a big part of it, which I don't think we saw as much of it with laparoscopy, not like we're seeing it with robotics. But there was this argument of laparoscopic gallbladders, right? Weren't there people throwing tomatoes at surgeons that were saying these should be done laparoscopically, and there's a high rate of bile duct injuries and so on. So do you think we're in an equivalent scenario with robotics, or is it totally different?
Oh, I think it's different because the concept of minimally invasive surgery still carries over,
Okay.
right?
Yeah.
Oh, and I forgot that the other thing that I was happy about that I helped with was developing the critical view of safety with Steve
Mm.
Strasberg.
With Strasberg,
Yes,
yeah.
for sure.
Yeah,
Was that
so
that was during your time at Washington University,
it
WashU?
was you, yeah,
Yeah.
yeah, it was 95 that we published that paper.
That may have been your lecture
May
at
may have
UCLA.
been, may have been. Yeah, but if you look at the CV, you'll see the same talk repeated 100 times, and oh, here's the next one, and that'll be repeated 100 times, and on and on and on. But the opportunities that this has given are just unprecedented. For, here I am, a 37-year-old just on faculty, and I'm in Germany teaching the German professors how to do gallbladder operations.
Wow.
We went as a group to China in 1991
Wow.
and took out gallbladders. I mean, and then took all the equipment back with us. I don't think they did another one for 5 years, but I mean, just
So
unprecedented
cool.
opportunities.
Do you have a wall full of all these pictures of different areas you went?
No, I don't, because then, we didn't have a phone that took pictures back then.
True.
That's true. That's
You had
true.
to actually think about it and take a camera
How
and
cool
then
though.
develop the film. Jeez, it was ridiculous.
How cool.
And that segues a little bit into the next question, which is about collaboration. Also very evident from the greater than 200 publications is the many multi-institutional collaborations that occurred here in the US and abroad. What's the secret to working together? It's hard enough to get surgeons to work together in their own hospital. So how were you able to do that around the globe and publish too? I think it's one thing to kind of go give a talk. It's another to match strengths and put patient lists together and do this. But you did it over and over and over.
Well, I think a lot of that relates to relationships.
Mm-hmm.
I mean, it's unlikely that you're going to try and do a collaboration with somebody you've never met before. And I think it makes it way easier when you're simpatico with people and you have similar thoughts in terms of what you think is important in whatever this research is you're trying to put together, and plan well before it all begins, because once it gets started, it's hard to undo what you've done. But again, I think it's mainly relationships. And I've been, again, really fortunate to be able to make friends around the world. And hopefully one day I'll be able to do a lot of traveling and hang out with them again.
I'm sure you will. I mean, you're going to keep getting invited to talk.
Not nearly as often anymore. And it's just as well. Let the youngsters do all this.
So have you been to every single SAGES meeting, or have you accidentally missed one?
I have been to
since
every-
you became
I've
a
been
member,
to
of course.
every SAGES meeting
Yeah.
since I became a member in 1990.
That's so
Really?
cool. That's really
Wow.
good.
That
And
is
then I was president in 2001, 6 months or 5 months before 9/11.
oh
Oh,
wow.
wow. Yes, yes,
And the
yes.
meetings then changed significantly from then on.
Wow. Did that alter the meeting that year
It was
significantly?
5 months before, April to September.
Oh yeah.
But the year
Okay.
after it altered it. And the
Yeah.
year
Mm.
after the meeting was in New York City,
Yeah, I remember that.
Oh,
the
Yeah.
wow.
World Congress. And that's when they had the lights going up from
Yeah.
the towers into the sky. And that was a very emotional meeting.
It was very emotional. Yeah. Well, then you would very much like our famous part of this SAGES Story podcast. We call it the We Are the SAGES segment.
We are the SAGES. Sing it, everybody. We are the ones who make it bright our day, so let's start treating. Have you had a good time tonight? There's a choice we make. We got a lot more coming. We are dancing, patients' lives. It's true. Let's give a big hand for SAGES Fari. Give him a big hand.
So as part of this segment, we want you to recall one of your most memorable moments at a SAGES meeting.
Well, there are a bunch, and I'm sure there's some that I don't remember very well too, but
By design.
That aside,
Yeah.
in 1990, I want to say maybe 92, the meeting was held in Washington, D.C. And we were in this ballroom for the dinner, and the Capitol Steps, a singing group of guys, professionals, who gave a performance at the end of it. But then a bunch of us young leaders within SAGES got up and we were the lap rappers, and we actually
Yes.
did a rap song, all with crazy clothes on and stuff, including George Bursey wearing one that said "We'll work for sex."
Oh, gosh.
I want a picture of that one.
Oh,
And but
oh,
Hunter and
gosh, George
Swanstrom
Bursey.
and Ponsky and
Oh,
Jeff,
man.
I mean, you can imagine who the usual cast of thousands were. And that's how the Friday night sing-off started, was as a result of that
The
performance.
lap rappers.
Rappers.
Wow.
Yes.
That's the origin.
That's
The
great.
origin story. There you go.
Well, we've picked your brain significantly in the last 45 minutes or so. And as we wind down, we have a few more questions. So the first one is, and I know that you don't know necessarily who's been on before, but who should we invite next on the show?
Well, I just mentioned a bunch of names.
Yeah.
But I'm
Yeah.
A
sure
couple of
on
them.
your-
Yeah, a few of those are already. Yeah, we've hit a number of those already.
And, and there are ones who, as you said, like 100-year-old George Bursey, you want to grab hold of quickly.
Oh, we got him. We got him.
Oh, I know.
We didn't get
I
his
know.
t-shirt though.
We didn't get his t-shirt. Yeah, that's true.
I actually was a visiting professor at Cedars a couple of weeks ago, and I
Yes, last
stopped by
week.
and saw George for several hours the day after, and we chatted about things, and he's amazing.
He is amazing.
Going
He's there.
strong.
He is there before anyone else.
Yeah,
6
he was
o'clock
at
in the
my
morning.
grand rounds, and amazing guy. I mean,
Yeah.
what a hero to many people. So, I mean, I think you just go through the list of SAGES presidents and try and get every single one of them.
This is true. We didn't talk much about your family. Do they know what an amazing person you are, or do they just think you're dad?
Oh, they think I was gone too much. And the problem with SAGES
Okay.
was the SAGES meeting was almost always during spring break.
Mhm.
True.
And I would
It's
always
the same this year.
And I would always choose SAGES, and
Yeah.
never live
it's-
that down.
Mm,
I tried to invite them this year. The prospect of Montreal in March, having been there actually with them in June of last year, like, yeah, we're good, Dad. We're gonna
Yeah, that's right.
gonna
See you
stay-
later, Dad.
we'll
that's
stay
a
in
good point,
Cleveland.
though.
We'll stay in Cleveland.
But that's a good point. No one's mentioned the fact that it's always during spring break.
It's often during
Often
spring
during
Often,
spring break.
often.
Yeah.
Really?
Yeah. Yeah.
Yeah.
It seemed like always when our kids were young.
Yeah.
So no, I told them I happened to be in the right place at the right time, and so they think I just lucked out.
Very good.
Where are they all now?
Yeah, but we two sons, both in California, one in San Rafael, just north of San Francisco, and one in LA.
Oh,
Perfect. Great place to be.
yeah,
Hi,
great
Kevin.
place. Yeah, absolutely.
There
Gonna be
you
in
go.
LA 4 times this year, so it's a great
Mostly to
place.
visit me. He misses me.
Yeah,
This
exactly.
Zoom is not good enough.
Yeah, it's to get free shirts.
Free
I'm
free
running out
t-shirts.
of yeah.
And I'm sure you guys make huge honoraria doing this from SAGES.
Oh, huge. Yeah.
Yes, $1,500 for
Just to
we
observe.
send the invoice.
Yeah. We
Well-
get, what was his answer? We get paid in goodwill. That's how we get paid.
Goodwill. We
Yeah.
get paid in
Goodwill.
goodwill.
More
There
than
you go.
enough.
Perfect.
Well, listen, on behalf of the entire SAGES organization, as well as our listeners, we would like to thank you for joining us on this episode. We appreciate you taking this time. I think 45 minutes or a little bit more just to share with us. As I said, I'm so grateful just to get
Yes.
to know our leaders, and you're certainly we would have had you on a lot sooner if we could have. We feel sorry for.
Yeah, oh yeah, I bet you do. No, it's been great. And thanks for including me.
It was lovely. Thank you so much for your time.
All right, guys, take care.
And that wraps up today's episode of Sages Stories. You can view the show notes for any links to sites we referenced today. Visit sages.org for membership information and for the most recent news from our society. Follow us on Twitter at @sages_updates. Make sure you hit the like button and subscribe so you don't miss any future episodes. See you again next time, and remember, you can't spell minimally invasive surgery without SAGES.